Nandu, I want you to address something real quick. So I have 3 kids, born in the U.S., now living in Kochi for the last 8 years, 14, 13, and 11. And we have 1.2 billion people in India, 600 million under the age of 30. Everybody knows the stats. So we know how to procreate. We're encouraged to get married and have kids, but who has ever sat down with their parents and talked about how to do that? We have, now with the internet, you know what people are doing, what kids are doing, what my kids are in position to do, because we have iPads, iPhones, iPods all around. They can go to the internet, they can go to Google, they can go to Wikipedia, Yahoo, and they can type in those words, whereas I didn't have that when I was younger, so we were a little bit more protected. So there's information out there, including leading to porn sites, that you just don't want your kids to have access to. So one of the things I really appreciate about what Nandu's doing, and by the way, for housekeeping purposes, we've been given an additional amount of time, 10, 12 minutes, because some of the schedule is adjusting to it. We're going to line up for questions, so if you're rushing to get out for a session, don't worry about it. Everybody's kind of adjusting to it. But Nandu, recently, so we don't do a good job of talking to kids about it and providing them the ecosystem, and yet we're giving them an open door to go wherever their queries lead them to. So one of the things that Nandu's doing is addressing those taboos, and one of the things that Dr. Ruchi really advocates is reaching that population, because they need to understand from a health perspective what those taboo subjects lead to. So Nandu, can you, it's a funny story. Was it this year when your server crashed?
Yeah.
Yeah, so they posted a video on a particular topic, and then before you know it, they had stress on their infrastructure. Can you kind of tell us a little bit about that story?
Yeah, actually I think the microphone. So one of our, you know, if we look at one of our core areas that drive significant traffic for us, it's a frank and honest discussion about sexual health in India. So we did a set of videos where we interviewed people that were teenagers to their early 20s, asking them what's their perception of virginity in India, and why especially is that so skewed towards this concept of it's okay if you're a male that you don't have to be a virgin, but if you're a female, you absolutely must be a virgin. And so it was interesting because we just had, what we wanted to do is just use this, first of all, as a chance to solicit honest discussion about a topic that I can guarantee you 10 out of 10 teenagers have questions about: sex. I mean, it's like, I make few guarantees about my business, but that's one of them. I don't care if you're rich or you're poor, you're in Denmark, you're in India, wherever you are, if you are a teenager, you have questions about sex. And unfortunately, in a country like India, we've been told it's horribly taboo. In fact, my grandmother, again, who probably lives, you know, who lives 10 minutes away in Malaysia, was probably somewhat vilified that the fact that her grandson is creating videos in Kannada talking about birth control, you know. But she'd be much happier if I had taken, you know, a banking or an engineering job. But you know, this is what I do, and so we recognize that that's just a consistently popular area, and it's been so surprising to see how that spills over into other areas. I mean, like, you know, when we look at other very popular topics for us, women's health, menstruation, which is this very common, you know, basic part of physiology amongst all humans, but it's horribly taboo. You know, again, growing up in the household that we were told if a woman's menstruating, she shouldn't go to the temple. She should stay out of the kitchen. What a horrible message to tell to half our population. So we've taken very frank and honest discussions about that, and that, I think, because we approached it with a level of honesty and trying to be genuine about it and not be silly, not be stupid about it, and certainly not preach any morality around it, that has resonated with the young audience, and that, I think, is another reason that we've been able to connect.
Yeah, so when we talk about health being personal and individual, that's what it comes down to, because I know I'm trying to lead my family well, but I know my little ones are going to get on the internet, they're going to go poke around. That's very tweetable, what he just said. Somebody needs to tweet that. 10 out of 10 teenagers have questions on sex. And that's why digital health matters. So go ahead and tweet that. But that's very relevant. For those of us who grew up here and those of us who grew up in the Indian society, we know what the values are, but we also know the things that we don't talk about. And some of the things that we don't talk about have some serious health implications. So thanks for talking about that. I'd like to close up the session with you guys just leaving thoughts for entrepreneurs here. Now, we're going to have a conference here in this very place in February, Health 2.0 India, where we're going to expand on this for 2 more days. But it's a very entrepreneurial community designed, so people from IDEO, people from Frog Design, people from the health systems, pharma, everybody comes together to solve some of these problems. And so it's a great place for people to congregate. And this specific audience here being entrepreneurs, I would just like you guys to kind of leave the audience with the thought in terms of these are entrepreneurs, they have thoughts, they have ideas, any word of advice, even if it's 1 word or a sentence. And then if you have questions, we can queue up over there, and we've got about 6, 7 minutes
to happen.
My takeaway would be, for those who are thinking of starting a company, but there's really big companies out there that have money and ideas and smart people that are just going to do it anyway. I'll tell you, having been acquired by a company that was a 35-year-old patient education company in 90% of U.S. hospitals, it gets very difficult in a big company to innovate. I sat with Ravi and James at Health 2.0 Boston this spring, and huge U.S. insurers like Aetna and United and Kaiser Permanente and Pfizer, their heads of innovation are saying, we're no longer innovating internally. We realize we're not good at it. We're looking to you, the entrepreneur, to come up with the idea, and then we'll partner with you, we'll buy you, but we're not innovating internally. So they are looking to you, they're looking to me, looking to Nandu and everyone on this stage in this room to come up with the next great idea. And that's an opportunity that you have, is to be the one to take that idea and then spread it across the world for millions of people to benefit from.
Again, I take a leaf out of my own experience. Medicine is universal, but healthcare is very local. And I've seen, I think, what you guys are doing at MDill, I think that's just fantastic, because it's a very, very local implementation of a very specific issue. I mean, that will scale. That's got a tremendous opportunity to scale. And if you are an entrepreneur looking for those, be very, very, very specific about that. And then take that, be extremely passionate, okay? Find some partners, absolutely innovators, and scale. I think try it, give it a go. That's what I would say.
Yeah, I think, I guess for all the entrepreneurs in the audience, it's kind of funny, I'd say that as you're out there, you're pitching your idea and you're talking to people in the ecosystem, be it investors or be it naysayers that don't believe in it, whether it's you're trying to get your first partners, is to keep persevering. I kept a list of all the investors that I had talked to as I was trying to build my company, and if I had listened to even a handful of them, Nandu, this will never work. It's never, people in India, they want to see a doctor. And I'm like, there's not enough doctors. There never have been enough doctors. There never will be enough doctors. I think you can try to create information on a mobile platform. We started off by doing SMS. We pivoted now into video, and we found something that's really growing organically. So if you're out there and if you're an entrepreneur and you're having people tell you this isn't going to work, this doesn't make sense, I'm an investor, I see, well, blah, blah, blah. Don't listen to those people. Just you try to think about what are really big problems and really big pain points, and how you can think about solving those problems. Because if you can do that, there's a great business behind it.
Yeah, I think all of us would like to thank NASSCOM for opening up the opportunity to speak about digital health. And I would like to thank these guys for being real about the opportunity. There's only so much we can do in an hour. Come up and talk to these guys. We have questions in the audience. And also there's a conference in February that will expand deeper into this. And this group of people that we have around Health 2.0 are trying to be practical, real, and everybody is passionate about preventing loss or engaging health and improving health. One thing I always forget to tell people is I didn't have leukemia, I didn't have prostate cancer, I just had an infection in my blood, but it changed my life, and I'm better off for that experience. So if that's a question of yours, I answered it. Here's the first question. What's your name?
Badri. Hi, my name is Badri. I'm from Chennai. I'm an entrepreneur in healthcare. We're focusing on diabetes. The one consistent objection which is not said but which comes out loud and clear from most patients is that I'm not going to get any problems. I might have diabetes, but I will not have complications. Okay? So I just want to hear from somebody here as to how do we get beyond this mindset issue. Eventually, if you look at medical history, They're saying 9 out of 10 eventually will get into complications. But if you look at what the patient thinks, probably the 9 are the other guys. I'm not going to be the guy.
Yeah.
Okay, and that is a huge barrier for adoption, like she was talking about adoption barriers. So I just want somebody to clarify on it.
My take is that if it's that patient in Chennai, that information's got to come to him in Tamil, and he needs to be able to see a story, not just a physician behind the table saying, you know, you need to do X, Y, Z, but seeing and showing other stories of other diabetics. That is what's very powerful for people. I mean, I think universally one of the massive challenges that we've seen with all patient interaction is that doctors don't have enough time. My uncle's a doctor here in Bangalore. He maybe gets 10 minutes per patient on a good day, you know, maybe. So how can you possibly convey everything that a diabetic needs to know, that this is a lifelong condition? There's a lot of things you can do to manage it. It's not just about taking your insulin. It's about managing your diet. It's about getting exercise. Somehow that information needs to get conveyed to that person in a way that they can relate to it. And to me, I think that has to be done in a local language. We do it with video.
Okay. Yeah, I am one of the very few doctors here. I'm a practicing physician and trying to work around, you know, this healthcare and IT. I'm too immature to ask questions right now, but as a doctor, I've got two comments to make. One is a question to this gentleman that, okay, wait for some time. The other gentleman would definitely change his mind that he's not that one. You know, after some time he'll definitely change his mind. Well, regarding the adoption, you know, I've been thinking about this for quite some time, and apart from the facts which you have already mentioned, you know, there is a big thing which the people won't come up with, they won't tell you, the doctors on discussion and on questioning, they won't tell you, is, you know, the monetary aspect of it. They don't want anything to be written and documented for monetary aspect. You know, there's lots and lots of problems, you know, not in the, you know, doctors working in Fortis and Max and bigger chains where they get paid in checks. But beyond that, you know, they make money in cash. And this is a very big important thing. The moment you ask and tell them about EHRs, that records how many patients are you seeing. That records how much money are you making. And this is, I think, even if I am very good at Facebook, even if I am very good at Twitter, even if I read a lot of, you know, literature, if I see all these videos, everything is okay. But I won't document the patient's health records or how many patients I'm seeing on a digital platform. That is something, you know, that is one of the biggest challenge. Any views from the panel?
So, being a doctor myself, I would definitely answer your question. You have actually asked a very interesting question, and that's very true. And it all boils down to incentives. So, adoption of EHR, tablets, and all of that stuff in the US is driven by incentives. However, in India, there is nothing like that. In US, people hate health insurance companies, but you bet the quality that they are maintaining in terms of healthcare is not a case in India. So if there are meaningful reimbursement policies and meaningful incentives plans for doctors to adopt to EHR, document what they are doing, and it's all about the system. So the system has to change, and because I'll tell you, there is a very thin line between medical malpractice and medical error. And we all doctors know that anything goes here and there in documentation, and if you have a record of that, you will sue me tomorrow. So that's why doctors don't want to document it, and they are still going by the traditional means of prescriptions and health records. But once the systems are being set, the protocols are being defined, this will not be a problem. But I agree with you today, this is a problem.
Hey, sorry. I have a question. That's me here. Yeah. So hi, my name is Adarsh, and there's a question for the panel. I'm not sure who would be the right person to answer it. So as entrepreneurs, if we intend to get into what is affordable healthcare, right? Get into healthcare for the masses. And also kind of come up with a device or maybe a solution which requires a good amount of funding. Then that's one apprehension we have, right? I mean, what are the kind of funding agencies we need to approach to? Because all of them require, okay, how big is the market? How quickly can I get my ROI back? What multiples are we talking about? What is it, you know, those kind of questions. Secondly, the regulatory mechanism, right? If I am a startup and I intend to get into something like this, that's one other big major put-off. So your comments on this, please.
Dr. Ruchi and Ravi, you both can kind of address that.
So I work with a lot of venture capitalist firms, and I advise startups in terms of where they should go in terms of the legislative part of it and the funding bit of it. Answering the first part of your question, as to where the funding comes from, mostly there are venture capitalist PE firms and consortium of doctors as well who fund ventures like this. But there has to be a clear exit route, and that's why when Nandu made a statement, I was laughing that most of these bad companies get funding just because there's a clear exit route, but there is no integrated one-stop shop kind of a concept that should be funded. Second question of yours, if you don't mind repeating it, it was around the regulations part of it. So right now there are no clearly defined regulations for telemedicine, e-health or m-health in India. But more or less tomorrow, everybody will comply to FDA regulations, which are very much valid in the US. So whenever you make a venture, you make it for the future, and you have to be backwardly compatible. So just keep that in mind and try and comply to FDA from today onwards, looking at those resolutions, and sooner or later those resolutions will come in India as well.
The venture funding is not straightforward. I mean, it's a black art, right? I mean, I think that my best advice to you is find a peer group, find a small peer group, and you've got one here, I mean, who is a fantastic example here. And, you know, I've done it myself, and I think, you know, you've got an advisor here, and Mark has done it in a few times, you know, so it's not straightforward. There's no rule book, right? Yeah. Yeah, I mean, I think that, you know, she's advising a lot of people who are actually certainly in the startup space, and I think also in the venture capital space. So reach out to a peer group of people and work with them. Sure.
We have time. We have time for one more question, and then Nitesh is going to wrap up. And if you guys can vote here, and if you vote yes, you can grab a bottle of water on the way out. That's your prize. If not, you're thirsty for the rest of the day. Thanks.
Yeah. Hi, I'm Abhishek. We deal in indoor emission control filters. I have a very small question. Through this digital health, we can approach the patients at their doorstep. But how do we ensure they are getting a proper treatment? Whether they are getting after the doctor may put a noting what they are prescribing and how they are doing, but has he analyzed the proper problem for the patient? How do we analyze? How do we draw that?
Yeah, I'll try to make one attempt at that. I think that one of the probably one of the most frustrating things I've had when I've gone out and tried to talk about my business, arguably to venture capitalists who really aren't very smart and don't get it, is that they think that there's going to be this magic silver bullet that just fixes everything. Like when you talk to Gates Foundation, they're the ultimate, like, they're so out there. They have no idea what they're talking about. They're looking for a vaccine that's going to cure everything. Boom, you know? And the reality is that if you talk to people that actually work in the field, who are actually out there doing services, you realize healthcare, and it's not just this simple, oh, here's the pill, it cures everything. I've provided cradle-to-grave solutions for a patient. I mean, healthcare in the United States makes up almost a quarter of the GDP. It's $1 trillion industry. So even when I started MZIL, people were like, well, why don't you do electronic health records? Why don't you do patient compliance following up with this? Can you have some sort of further tie-up where you can take them to the hospital and give them treatment? And I'm like, look, if I was going to try to fix the whole system, like it would just be like pushing the boulder up the up the mountain. It would just keep rolling back down over me. I try to focus on an area, and I think that this is also maybe advice to other entrepreneurs in the area, is try to think about a very real problem within the healthcare field, and try to focus on that problem. I can't guarantee that a teenager watches my video and uses a condom. I can say that when we ran surveys, we saw that in aggregate teenagers were more aware of birth control and family planning and the risks of STDs. I can't be there to guarantee that the 17-year-old kid's rolling on a condom. Nobody can, and while other people are going to go look for that silver bullet, hallelujah, good luck to them. We know that we're focused on this core area and trying to solve that problem.
All you can work on is a simple principle that an informed patient is an empowered patient, right? I mean, that's all you can work on, the principle.
And Ravi sits on the the patient safety committee for Harvard. Come and ask him those questions. And so I wanted to make that comment. Thank you all for being attentive. And if you have questions for the panelists, feel free to come up here. That's, to me, is the most important part of the day. Nitesh has some announcements, and we're going to huddle up real quick to decide who the prize goes to for the question.
Thank you, James. First of all, can we give a big round of applause to all our panelists and also to James for organizing it so well. Okay. Before we go to prizes, we need your feedback for this, and there's no any call charges for that. It's just a missed call you have to give, and this is really important because we want to improve next time. So your feedback is really valuable, and we would like you to give feedback for this session. All right. Okay. So we have the results for this award for most interesting question, and sorry I forgot the name, but this goes to that guy.
Everybody asks great questions. I think we're giving it to the entrepreneur in the house. So here you go. Thank you.
Okay, so next session in this hall has been cancelled, and the lunch will be served at 1:30. So till then, we can attend sessions in other halls. Thank you. Thank you, everyone.